Good morning.
Good morning. How are you? This is Alan Leshner. I'm the guy at the front of the room. We see you. Do you see us?
Good. I do.
Okay. Please, ladies and gentlemen, Keith Hotle, I hope I pronounced that right, from the Wyoming Department of Health. Please, we have a
Uh,
little clock running here that at the end of 15 minutes will explode. No, it just turns red.
okay, well, I'll try to be brief then, and thank you all for accommodating the travel difficulties out of Cheyenne yesterday. Um, well, without having the benefit of hearing my fellow panelists, I'm going to go ahead and go with the slides that I prepared. And I thought I would begin with just a few issues about the dynamics of suicide. Um, what we know from the research that's been done is that uh, firearms have a much greater fatality rate, a much greater rate of lethality than any other method of suicide um, that is out there. And so, for example, poisoning counts for about three-quarters of the suicide attempts, but only has a 2% fatality rate. So firearms pose a unique challenge for those of us dealing with suicide prevention, and particularly in the rural West where the vast majority of our suicides are completed by firearms. We know that the risk of household gun ownership dramatically increases the likelihood of a suicide within that household. And that the risk may be as much as 10 times that in households where there's no gun present. It kind of begs the question because oftentimes people say, well, if they're not going to use a gun, they're going to use some other method. And I want to talk about this issue a little bit. What we do know is that suicide is primarily a temporary crisis-oriented kind of dynamic. And even though suicidal people may be depressed or thinking about suicide for some time before they actually attempt, that generally the interval between the decision to take one's own life and the actual attempt is very short. And you can see from the statistics, about 25% of suicides, the interval is less than 5 minutes. So the takeaway from this is that once a person decides to take their own life, the window of opportunity for other kinds of intervention really is not there. And if they have access to their preferred method of suicide, in this case we're talking about firearms, it's particularly problematic when you look at that short window and the availability of easy access to a gun. So I just want to dispel one common myth, which is that, well, if someone doesn't use a gun to complete suicide, they're just going to move on to some other kind of method. And there is some validity in that, but by and large, um, if you don't have access to your preferred means, in this case guns, folks don't ordinarily move to another form of taking their own life. So the challenge is to try to get into that window of sort of suicidal impulse and take away the preferred means. In other words, make sure that they don't have access to firearms. And I'll talk about that in a couple of minutes when I put down our recommendations. And even when a person who is going to kill themselves with a firearm doesn't have access and uses a different kind of means that's less lethal, there is a much greater likelihood of survival and therefore the opportunity then to get that person the help that they need sort of after the post-suicidal crisis. So with those facts in mind, our priority research topic recommendations are number one, research related to the characteristics of the firearm that's used in the suicide. Number two, the lethal means restriction, interventions, and research related to that. and then research related to some of the risk factors specific to firearm suicide completions. So our first recommendation comes out of domain 1 that we were presented with, which is the characteristics of gun violence. And so from a public health perspective, for those of us who are trying to do prevention, it would be very helpful to us to have research to determine what are the characteristics or the circumstances that surrounded the firearm that was actually used in the suicide attempt or the suicide completion. And there is a paucity of data available to us. Examples of kinds of things that we don't know that would be helpful in prevention are the type of firearm used to some extent, the date the firearm was purchased. In other words, was it purchased the morning of? Was it purchased 10 years ago? We simply don't know that. Other things are who is the gun purchaser and who is the gun owner? I mean, who are the owners of the guns that are being used in the suicide? In Wyoming, it's often assumed that, well, it's probably the person that bought the gun because our primary problem target population when it comes to firearm suicides are men, both in their middle ages and older men. But we don't know that. So that's a data gap for us. We also don't know much, if anything, about how the gun might have been stored. Was there a gun cabinet? Was there a gun lock? Was it under the pillow or under the bed? And so we don't have any data around that kind of information. And then finally, data about how the gun was actually obtained. You know, was it taken from a parent? Was it taken from a friend? Was it borrowed from a buddy? We simply don't know that. And these kinds of data would help us to decide, you know, at what, you know, where to focus our prevention efforts in terms of safe storage, access, and so on. Our second recommendation is from Domain 2, and it talks about interventions and strategies. We know that counseling individuals and their families about lethal means is a best practice for suicide prevention. But we don't have, I think, the level of research that we need to know the effectiveness of that kind of intervention, the counseling, access to lethal means, at individual levels or within particular populations. And so doing more research around this access to lethal means counseling would be very helpful. Also, research around what kind of messaging would be effective to improve this kind of intervention. We're talking both about the individual who's at risk and the family and friends of that individual. So what kind of messaging is out there? What kind of communication strategies would be useful to increase this kind of intervention? In a state like Wyoming, where the Second Amendment is a very important value for most people, we really have to frame our conversation throughout the rural West in terms of not restricting access to guns per se, but really what can we do for that person during their temporary moment of crisis that can make them more safe until they get the help they need. And so, you know, for us, this kind of intervention is extremely important and provides promise for us, except we don't have all the good data that we would want to know about how to implement it most effectively. And then finally, what kind of methods could be employed to institutionalize or normalize this kind of behavior in states like Wyoming or in any state really? You know, we analogize it to the designated driver situation. 20 years ago, folks wouldn't have even known what that meant, and now it's a fairly standard practice of harm reduction is to designate someone to drive your car home or to drive for the night or whatever if you've been drinking too much. So what kind of communication strategies, what kind of message would begin to make this normative behavior instead of something that is the exception rather than the rule. And then normative, not only within the mental health community, but also within primary care, within other settings, substance abuse providers, and so on. And then finally, domain 5, the risk and protective factors. We don't really have good data at all about what the circumstances were that may have led an individual to attempt or to take their own life, particularly with firearms. And so, there's this whole issue of background checks across the entire debate. Within the suicide prevention community, that might be particularly helpful to know because, the general research demonstrates that somewhere between 60 and 90% of people who take their own lives, even if the actual act is impulsive or the final act is impulsive, that there have been things that have led up to that. And 60 to 90% of the cases, it's substance abuse or mental illness. So for us, a well-tailored or well-developed background check might be effective in reducing firearm suicides. Other kinds of background information that would be helpful to know that are really, in the West anyway, sort of intrinsically entwined with firearm deaths are, alcohol and drug use. Oftentimes alcohol is used at the time of the suicide or has been used in the previous days, weeks, months, hours before the suicide. And oftentimes those folks may have a heavy alcohol use or dependency issue. So those kinds of background facts would be very helpful to us because that would give us then opportunities to intervene upstream before that suicidal impulse hits. And that short window of opportunity is there between the actual decision and the suicide attempt or completion. Those are, in a sum, our 3 recommendations, and I'm happy to talk more about any one of those.
Okay, thank you very much. I have a zillion pages of notes. What we're going to do now is to turn to the committee, and Mr. Dr. Hotle, please stay on the line with us.
Of course.
Again, we're going to restrict the questions to the committee. Please direct them either to an individual panelist or to the panelists collectively. Who wants to start?